who's joined us today. Welcome to our first of many town halls where Families Together members, both families and young people, have the opportunity to address and work with legislators and commissioners from the various state agencies and committees in the legislature that serve our families and young people. I'm Paige Pierce. I'm the CEO of Families Together New York State. And this is our first town hall as part of our Family Empowerment Month. And as we've said many times, our families and young people are involved in multiple systems. We don't fit into the silos that are often created by bureaucracies. And so we wanted to be able to have dialogue with the commissioners of the various state agencies that serve our families and our children, and also with the chairs of the multiple committees that address our families' needs and our children's needs within the Senate and the Assembly. So it's my honor to be able to have our first town hall be about addiction services and supports and recovery. We have with us today, and I'm going to just introduce our moderator, who's going to introduce the panelists. But we have the chairs of both the Senate and the Assembly and the commissioner from OASIS here with us today. And we have ambassadors from who are family and young people with lived experience who have great questions to ask our leaders. So with that, I just want to introduce Courtney Lavelle, who is going to be our moderator for today. Courtney?
Thank you, Paige. Hello, Commissioner Cunningham. I'm really excited to meet you. Hi, Maria. It's so nice to see you again. And hello again, Senator Harcum and Assemblymember Steck. My name is Courtney Lavelle, and I am a former young person who's been in recovery for a while now, and I'm feeling extra aged after the past couple pandemic years we've had, but was able to find recovery from my opioid use disorder at just 19. Because of some incredible supports, helpful peers, and a loving family, I've been able to build a long career now in the addiction recovery space, and have seen some great changes unfold over the past decade, especially here in New York. I have the pleasure of being the director of cross systems engagement, education and outreach at Families Together, and so that I get to work on issues like addiction and its intersection with many other systems. I also get to host incredible panels like this one. Addiction recovery is not just a hot topic today. We are in an overdose crisis, and we're losing lives faster than we ever have before. Now more than ever is the time to put aside differences and find a new willingness to do even more together to change the trajectory we find ourselves on. We must help people stay alive while we build even more inclusive, welcoming systems of care that can uplift our most vulnerable community members. And we can do this together with the help of family members, peers, and our allies at the state, such as yourselves. Thank you all for being here and being willing to do just that. As Paige said, we have inspiring advocates ready to be our ambassadors today and ask some questions of our allies. It is not an easy thing to do, to use your personal experience and hardship to advocate for change for others. So above all else, thank you for showing up today and every day, Cheryl, Ashton, Alex, and Stephanie. Thank you for being the voice for those who no longer have one to use today. With that, I'd like to invite Cheryl to ask the first question of our panel.
Good afternoon, Commissioner Cunningham, Senator Hackman, Assemblyman Stack. My name is Cheryl Williams. I'm from Long Island. I'm a Long Island Regional Parent Advisor with Families Together in New York State for about 20 years. I'm here today asking for your investment in families. As we all know, families are struggling to raise children during what feels like an incredibly turbulent time. Deadly addictive drugs are more readily available in our communities than services and supports. This is upside down. Families struggle with the old message of tough love and the idea that individuals must hit rock bottom before choosing recovery. For instance, when a young person had a bad day and messes up, They may be kicked out of a recovery program, educational setting, or recreational activity. We need to support that foster inclusion and connection, not punishment. The Center of Motivation and Change in New York City and Recovery Research Institute in Massachusetts support and promote families and loved ones as part of treatment. So I encourage New York State to follow this science and treat families as part of the solution. Now, this leads up to my question, and my question is for the Commissioner, Senator, and Assembly. How will you promote utilization of family peer support for families struggling with addiction? I'll repeat the question again. How will you promote the utilization of family peer support for families struggling with addiction? Thank you for taking my question, and I'm looking forward to your answers.
Thank you, Cheryl. Commissioner, would you like to answer first?
Sure. So I'm Dr. Chinazo Cunningham, the Commissioner of OASS, and I just want to start out by saying I'm really excited to be here today. I've been on the job for 2 months, 2 whole months.
Wow.
So I just want to put that out there that I am still, gathering information about what we do as an agency and really talking with my team about how to move forward. I just want to start out by saying that we certainly value the role of family in the recovery process, and my team is working to increase the role of families in a variety of ways. And so some of these ways include we support family support navigators across the state to assist families in navigating the service delivery system. We also have a designation for our certified peer recovery advocates as well. That's a family designation. So those peers, have additional training specifically and helping families deal with substance use disorders. And so we know that there's not a ton of them around the state, but this is something that we're actively working to improve. And then another example is training our certified peer advocates and others in the community on the community reinforcement family approach known as CRAFT. And so this is something that we're going to also continue to train and partner with, really in our work with Partnership to End Addiction. So those are some of the examples that we have. We're really trying to, focus on the family specific supports a lot and really harnessing the value of the peers.
Wow. Thank you, Commissioner Cunningham. And you've been here 2 months, so welcome aboard. Thank you for your supports.
Thank you.
Thank you. And I'll just follow up briefly. I'm really happy to hear the mention of the CRAFT model. It's a wonderful family support model that we have to use, and as well as the efforts to expand the CERPA-F. I think we only have 12 certified here in the state. So any efforts to try to expand that and also expand the regulations on where you can implement CERPA-Fs is going to be really helpful to get families the support from other family peers that we really need on the addiction side. So thank you for that. Senator or Assemblyman, do you have any comments to follow up on that question?
Sure. Thank you, Courtney. It's great to be here. And Commissioner, again, welcome. It's great to have you. We're really lucky to have you in New York State. Thank you to Families Together and for the ambassadors. Great to be here with my colleague and partner, Assemblyman Steck. We do so much together legislatively. And like many of you, I'm in long-term recovery myself. And so, part of my calling as I see it is to help folks get the same benefits that I had, access to treatment, access to insurance, to aftercare, to medication, to therapy, and then those social determinants of a successful recovery, safe, stable housing, employment, transportation, those kind of things. And part of that is family supports. We know this is a family disease, so we need to reach out and help families to recover through this together. And a lot of that centers around, as the commissioner mentioned was peers. So we've had successful legislation to allow billing for peers. We have another piece of legislation to allow our recovery centers to bill for peers. So we can give them a source of revenue and a place where families can come together. But we've got to do a lot more in the schools. We have recovery high schools. Those have been proven to be successful. We need to fund more money to them. Their funding is up this year, so that's something that we need to reconsider. And one of the things that is so critical to the crisis, and we had a crisis before the pandemic, was the trauma in our school systems. And so many kids are bringing trauma to schools. You know, when we talk to superintendents about what they need, you know, of course, they're always going to say, well, we need more foundation aid. But what they always specifically ask for is designated mental health funding. And I think we as a state need to do much more for community-based, school-based, family-based mental health funding, because so often it's the structure of the family that has gone through the trauma together, and we need to work through that together. So thanks for the question, and I'm really thrilled to be here.
Assemblyman, you're muted.
I was going to
There
say
you
being
go.
muted might be a good thing, but
It could be a good thing. So thank you so much, Alex. Senator Hockman, thank you so much for your answer, and thank you for sharing your personal piece, you know, to show that you have lived it. So you're the best person to actually be supporting us. So thank you for your support.
Thank you, Cheryl. And Assemblymember Stack?
yes, I think one of the difficulties that you have when you get assigned to this chair is everyone in the advocacy community seems to think you have absolutely no experience with any of these issues. And I can assure you on both the mental health and on the addiction side that I do, not necessarily me personally, but certainly through family members. So the need for support for the families is painfully apparent to me. And I would say that I listened carefully to what the commissioner said about the various things that were going on. I'm interested in knowing, Ms. Williams, if you had something that you wanted to raise in particular that the commissioner did not mention as one of the things you'd like to see happen.
Well, what I would like to see, the commissioner did mention about the navigators. She also mentioned the peers that are working within the recovery system. Now, Families Together, we have family peer advocates, and the family peer advocates do have lived experience, and they also have to go through the PEP training, which is Parent Empowerment Program. PEP, yes, I think that's it. Parent Empowerment. So we have to be credentialed. So in the Oasis world, it's lived experience they're having in Families Together world. What I really would like to see is more peers, build your capacity within the drug and addiction platform, and actually put money and funding into hiring more peers with lived experience to actually be part of it. That's what I would like to see. And if you have the money, we're willing to take it.
Well, I will say that this area, because of the opioid settlement and because of federal aid, the budget is expanding enormously. It's a 55.6% increase.
Wow.
There are a variety of programs that are being funded. Not a lot of new stuff. I would say that the focus is on workforce retention, the emergency 24-hour centers, the hotline. We didn't find anything new in the budget with respect to co-occurring disorders, which is a weakness in our opinion. So that there's a lot in the budget. It's pretty much going, though, to existing programs and the ones I mentioned.
Oh, thank you, Assemblyman Steck. But I was expecting to hear, okay, here is the money we're going to send to put family peer advocates in.
This is the
Thank
governor's.
you.
This is the governor's
Thank you.
budget. Now, this is the governor's budget, and that's what I'm highlighting for you. The end budget could be different and hopefully will be different in certain ways.
Well, thank you for your support and totally understanding. Appreciate it. Thank you so much.
I also just want to jump in and actually respond, Ms. Williams, about your comment. So you know, and I think that everybody, Senator Harcum and Assemblymember Steck, had commented on this about really having the experience. So I'm a physician. I've been working in internal medicine and addiction medicine, and I've been working with people who use drugs for over 20 years. I got very little training about drugs in medical school. Like over 4 years, I got 1 hour of training. I mean, it's terrible. And the way that I learned about addiction and how to work with people with addiction was through working with peers. And so I personally went and did outreach in the Bronx and in Harlem with community-based organizations and peers for 10 years, once a week. I did. So I learned a tremendous amount, really everything I know from peers. And so I just say that because I very much value people with lived experience and what they have to bring to the table, regardless of, you know, if there's no formal education or letters after their names, and really see peers as a key, you know, playing a key role in really all of the work that we do. And so you know, so I just wanted to sort of let you know about my experience, because that really shaped me and who I am today, is really working very, very closely with peers for a decade.
Well, thank you, Commissioner Cunningham, for sharing that. Really appreciate it. Because with peers, you know, if a family is going through any situation, the first person they may speak to or feel more comfortable with is with a peer. So thank you actually for highlighting the value of having peers.
Yes, and thank you, Cheryl. And just to piggyback up on that with the SERPA F, you know, that is a trained and certified credential that family peers can hold. I think some of the barriers that we have with seeing SERPA Fs expand are in the regulations and where they can work, and just the 823s and not in 822s or 820s. So some regulation changes could make them more accessible to families and other treatment settings. That could be very helpful. And I would like to move on to Ashton, because I know his question kind of ties into some of what we're talking about now. Ashton, can you unmute yourself?
Yes. Hi, everyone. Hello. I'm so full of gratitude to have such a fantastic audience and people to collaborate with. I'm just full of emotions and feelings, and I'm so grateful. Thank you all for being here. So my name is Ashton Daly. My pronouns are he, him, his. I'm a young sober person in mental health recovery, currently living in Albany, New York. I am the Youth and Young Adult Recovery Program Support Specialist with Youth Voices Matter New York, part of Friends of Recovery New York. Thank you all again for being here. So according to the Oasis Regional Resources website, there are only 23 youth clubhouses serving 22 counties. 3 of those clubhouses serve multiple counties, and only 4 of them are serving Indigenous communities. Clubhouses offer so many things: safe, sober spaces, peer services, counseling, sometimes even treatment, prevention resources, and connection to a larger pro-social community. So my question is, with that context in mind, what is your plan to ensure that each young person in the 62 counties that are in New York State have equitable access to the vital resources that clubhouses can offer, and could collaboration with other agencies like OMH help with that process?
Thank you, Ashton. Okay, who would like to respond first?
I can take a crack at that, Ashton. Thank you so much for your question. You know, we know that peer engagement is critical on the recovery path. And we also know that we have tremendous deserts in New York, whether it's for recovery centers, whether it's transportation, whether it's for recovery housing. So it's about leveraging the resources the best way we can. You know, as Assemblyman Steck said, we're getting more money. I don't think the state can afford to build a facility in every county. But what we can do is leverage resources. For instance, the last couple of years, I've gotten money in the budget for an evidence-based program that works in Boys and Girls Clubs. So it's the same sort of principle. So how do we leverage existing community organizations that already may have the brick and mortar infrastructure? I think that's a more cost-effective way to go. But for instance, the Boys and Girls Club wants to expand that program statewide. So that's one of the things that we'll be looking into. There are also student-run crisis hotlines that certain universities have. We want to see that model roll out more. We have legislation that would require colleges in New York to provide safe recovery housing. So recovery communities of students can live together with the wraparound services that they have. And we spoke a little bit before about recovery high schools and allowing recovery centers to build for peers. So when they have a viable financial model, they can serve more students and more young people. So it's kind of a mixture of things that we can do to try to expand the network.
Awesome. And I love your mention of collegiate recovery programs. I know that's a personal passion project of mine. So I'm so excited to see, even if we can't build brick and mortar.
Let's work on that together. Let's talk offline about this.
Absolutely.
Thank you.
So I'll jump in just to, I definitely agree with Senator Harckham. I think, certainly youth clubhouses are, invaluable support for young people. And in addition to some of the services, Ashton, that you described, even some basic services like food and clothing, right, are also available in a lot of the clubhouses. But I think, for us, it's more of sort of the approach of like, do we need a clubhouse in every county? It's making sure that we have services available, right, for people who need them. And so for us, we really want to make sure that those recovery services fit the needs for the counties and the communities. And so part of what we're doing, our adolescent team, is really identifying right now where the recovery services are for young people, where they're not, and then what are those needs in those spaces. And so really taking, for me, like an evidence-based approach here to say, like, what is happening, what's not happening, what are the needs in the areas that are not happening, and then how do we address those needs. And so some of the questions are also like, perhaps we take an existing program in OASAS and then add on programs that are specific for young people, right? Rather than creating a whole new program. So, or, maybe there's things in colleges, like you're saying, that can need, additional programming. So I think, those are thinking about what we already have, leveraging those resources that Senator Harckham was saying, but then it's maybe adding an additional piece of that if there's no, if there aren't as many services for young people as are needed. So that's kind of the way that we're looking at it in terms of moving forward. And I just wanted to also introduce Maria Morris on our team at OASS, who has been working in this field with families and adolescents for decades, a real expert in this area. And so I'm not sure, Maria, if you have anything more to add.
Commissioner, you're absolutely right. Ashton, we've enjoyed working both with YVM and Families Together over the years. And we just had a conversation this morning about kind of doing that SWOT analysis of what are the resources that are currently there, and then how do we build upon them, including taking a look at the recovery centers that Senator Harckham recommends, references, and seeing if there's a way of adding a family approach or a youth approach to some of the work that they do. So the two bureaus within ATAR will be talking shortly, and then trying to move things forward as we go. So thank you for the time.
Thank you, Maria. And thank you, Commissioner. Thank you, Ashton. Assemblymember Steck, do you have any comments to add to this discussion?
No, I'd be curious as to, again, after Ashton heard the comments of the commissioner and the senator, what he would wish to add to what they said.
Oh man, if I had the time to talk about my wish list, your ears would fall off.
Pick one.
Pick one. Oh my gosh. Oh wow, just one. Equitable
Just one.
access to services. Equitable access
that?
to services. So touching on those harm reduction services, not just harm reduction and substance use, equitable housing, transportation, access to clean water and food and healthcare, just equitable access to those services that keep kids healthy, because healthy kids, healthy families, they make healthy communities.
The budget does increase funding for housing, by the way, so that, again, my understanding is that's an existing program, not a new one, but when I was chair of the task force on people with disabilities, we had quite a struggle to get money into housing for people with disabilities. So in this area, I'm very happy to see that that is in the budget.
I also want to just jump into Ashton. I really appreciate that comment. So for me, my team at Oasis has heard me now say this many times, which is that for Oasis, one of the key guiding principles for my vision is really approaching everything we do from an equity lens. And that includes regulations, programs, it includes, hiring and promotion. I mean, the whole way through, procurement, et cetera. So we are starting by, we have a chief equity office that we are creating. We've already have a job posting for a chief equity officer who's going to be leading all of these really throughout the agency. And so this is, really using that lens to look in everything that we do. And I think, Senator Harcum, maybe you're going to talk a bit about the equity committee. I'm not sure. Yes. Okay.
Go ahead. You're on a roll. Go for it.
I mean, I think that the other thing is, so, it's also very hopeful to see there's a lot of interest in really, bringing equity to the table in all of the work we do. And so, sort of seeing this also play out in terms of statute now is to have a committee. I'm not even sure of all the details, and maybe Senator Harcum, you can fill them in, that really, again, is to create a committee that focuses on equity for OASS. And so I'm excited for that, and for our chief equity officer to be a liaison and to really have this be just part of what we do, all the way from top to bottom for the agency. So I'm very happy to hear you say that, and this is something that is really critical and important for me.
Absolutely.
Yeah, and just to flesh out what the commissioner was saying, we're really excited to work with her and Oasis on this. Last year, we passed legislation for a council on treatment equity. And so the governor signed that into law, and those appointments are being made as we speak. And we look forward to that body doing very important work, because part of the treatment deserts that we have found are also through the cultural and equity lens, and we need to address that.
I'm so glad to hear that. Thank you. Thank you, everyone. This has been such a great discussion already, and we are only on to our third question now. Stephanie?
Hello, everybody. How are you? So, as most people know, I usually go off script, and I'm going to try really hard not to. So my name is Stephanie Marcasano. I am founder and president of the Harris Project. I live in Ardsley, New York. My 19-year-old son had co-occurring disorders and died by accidental overdose in 2013. I want to thank Paige Pierce and Families Together, as well as Andrea Smith, who I know is on, and the New York State Coalition for Children's Behavioral Health for being such incredible supporters of our efforts in the space of mental health, substance misuse, and addiction, especially as it impacts our teens and young adults. I would also like to thank Senator Harcum and Leader Stewart-Cousins for truly being champions of Bill 5084B and the creation of a single agency. Welcome, Commissioner Cunningham. We're so excited to have you as part of this team, and to Assemblymember Steck, always good to see you as well. As we look for innovative opportunities, and Senator Steck Assemblymember Steck kind of alluded to that. To turn
I'll take the promotion.
It's a sidestep, not a promotion. To turn the tide on overdose, suicide, and alcohol-related deaths, there seems to be a loss of momentum around creating a single agency in an Office of Mental Health and Addiction. We know that most misusing and/or addicted to substances have co-occurring disorders, and the evidence is clear that integrated treatment for co-occurring disorders is the gold standard of care. not sequential treatment, taking care of the substance use disorder first and then the mental health disorder, nor simultaneous treatment. You go here for your substance use disorder treatment and there for your mental health disorder treatment. We also know that the time between the emergence of a mental health disorder and the development of a subsequent substance use disorder is a key window of opportunity where co-occurring disorders can be prevented. In Westchester County, we see how innovative prevention programming like CODA, co-occurring disorders awareness, is making real impact as is integrated treatment. The Harris Project just finished the first year of our Westchester County pilot of Encompass, an evidence-based treatment modality for teens and transitional age youth with co-occurring disorders. The pilot included 20 clinicians from 6 agencies and was funded by WMC Health. And now the Harris Project has requests for our training that begins tomorrow for an additional 44 clinicians to be certified, bringing a total of 8 participating agencies. But we only receive funding from the Westchester Community Foundation for 16 to 20 clinicians. These are agencies that hold OMH licenses, OASIS licenses, both licenses, and some even have integrated licenses. So here's my question. While it seems both OASIS and OMH state a commitment to addressing the needs of those with co-occurring disorders across the continuum, there remains many clear barriers in the current siloed system, including separate funding streams and a lack of integrated RFPs, to just name 2 of so many. I look at Ashton sitting there through Friends of Recovery. We are now collaborating with Friends of Recovery in Westchester to build a pro-social platform, which we can't figure out how to get funded. We funded the Harris Project craft training for 40 clinicians in Westchester County. We are literally single-handedly, through the commitment of our county executive, the Department of Community Mental Health, and our providers, building a wraparound system of care for co-occurring disorders without a dollar from OASIS or OMH. So we can barely fund these projects. I get requests statewide to bring these projects to other counties, yet we don't know how we're even doing this. So what can we expect? When can we expect true integration to happen? And if you are opposed, why?
Thank you, Stephanie. Okay.
Stephanie, I'll hop in because it was my bill, and it is my bill. And out of respect to the commissioner, she just got here. So she and I have spoken about this, and we want to give her the opportunity to really evaluate what's going on inside the agency, to have the conversation. But I will share a couple of things with you. One, in the Senate, we're still very committed to this. We passed the bill out of committee 2 weeks ago. It will be in our one House budget. And you described it perfectly. And as someone said before about bringing OMH into a peer-led recovery facility or clubhouse, we can't do that because those organizations are being denied grants from one agency or the other. And we need to break down those silos. At the very least, we need to braid the funding silos, but we need to break them down into a single stream. And, I want to thank you for your advocacy, because not a week goes by that I don't speak with parents who've lost a child the way you did. And it's very rare when someone passes away because it's their first time around the block. With fentanyl, that's a little more likely, but usually it's young people who've been in and out of treatment 6 and 7 times, and the parents say their mental health issues were never addressed, and all they wanted was some relief. All they wanted was Xanax, And so we really, as a state and as a system, need to find a better way to treat people holistically and unleash those funds so that we can. So yes, I have a bill and we are continuing to move it in the Senate. But again, I also want to work with Dr. Cunningham with her expertise, because her past position in the city, they were blended. And at the federal government, they're blended. And our counties, many of them are blended. So we will continue to move the bill. I will continue to work with you, of course. But I also want to look forward to working with Dr. Cunningham as she gets more involved and in-depth information about what's going on the ground with the providers.
Thank you, Senator.
So I'll jump in. So I'm a primary care provider and I've been, providing care for over 20 years. And so the idea of integrated care, of course, that's all I know as a primary care provider. So of course I value, treating co-occurring substance use disorders and mental health conditions. I would even broaden that to say also physical health, right? That we also need to integrate addiction treatment services into physical health care as well. So, it's interesting, Stephanie, you had said, you had pointed out as even one example is an RFP, right? That has the two agencies working together. And I'm happy to say that in the last few days, we did post an RFP, OASS with OMH on the crisis stabilization centers. And I think this is the way going forward, exactly the kind of work that we, are excited about and partnering with OMH, right? So these are crisis centers where people can come with a mental health crisis or a substance use crisis or both, right? And it's dual funding, dual support. And so I think those, looking towards that as the kind of example that we can continue to do more of. And then I would just, also just point out, we do have, all of the individuals when they come into an OASS certified program do get mental health screening that happens across the board. And then depending on what their screening results are, if they appear at risk, then they do, get a full assessment in terms of either on-site or arranged for that assessment. And then we also, have cross-training. So we've worked with a lot of the OMH providers to also provide training around, substance use disorders and, help them get waivered for buprenorphine treatment, for example. And so I think this is definitely something we value. I know we could do better. And, I certainly have been working with Commissioner Sullivan at OMH and continue, have met with her many times well before even coming here to this position at OASS. And so I certainly fully recognize the importance of this and, looking for ways to collaborate with OMH and to provide integrated care.
So I'm getting old. So while I have the three things in my head of what you said, I just want to address them because I know Assemblymember Steck probably has something to share. But one, I just like tidbits and things to think about. What we're finding with our primary care practices is they pick the one they like. They're going to infuse substance use treatment or they're going to infuse mental health treatment wherever they're comfortable. Our vision really is that if we can get sort of the brain side of things, the mental health and substance misuse addiction side kind of aligned, it will be much harder for the primary care crew to pick and choose what they like. 1 million people have already sent me the RFP for the combined stabilization center. And something that I want to just acknowledge is those are 23-hour and 59-minute centers. And if the people that are working in those centers do not have appropriate co-occurring integrated services to refer people to, the cycle is going to continue to repeat. And then the last thing, if I can remotely remember what that is the assessment piece. So one of the most exciting things about this new go round on Encompass is, for example, the Lexington Center. Now, one of the first go rounds, nobody only had an OASS license. Now we have 2 only OASS licensed providers that are joining. The Lexington Center shared that one of the real reasons why they were joining is, particularly in Mount Kisco, they've reactivated their teen program and they have 30 teens currently in that program. Of the 30 teens in the program, at least 95% have co-occurring disorders. And so with the ability to give their individual therapy, the Encompass model, they will have a much better opportunity for success than to send them someplace else for their mental health. So these are, and I'm not trying to be a pain in the neck. I'm just thinking you're doing amazing things and you're so on target. And I just want to share sort of the experience of where those things need like the next step. And that's kind of the beauty, I think, of opportunities like this and why I appreciate so much the chance to talk about it.
Thank you, Stephanie. And Assemblymember Stack?
Yes, I think what's absolutely shocking is that Stephanie and I agree on everything but one thing. I do not believe a merger of OMH and OASAS is in the best interest of the people of the state. I do agree, however, that one agency should have the ability to make the decisions with respect to the programs for co-occurring disorders. I have the exact same thought about the crisis stabilization centers as Stephanie did, and I'm sure the commissioner's staff is aware that we made the exact same point, which is what happens after the 24 hours are up. One of the things that's funded in the budget is a very successful program. It's medically based, is New York Matters. One of the things we're going to try and do in the assembly is to increase the funding beyond what the governor has requested for New York Matters. We think that would be helpful. I would also note that during the Cuomo administration, OASAS lost 150 positions, which could well be used to deal with this issue and provide agencies with appropriate personnel to deal with co-occurring disorders. I also support elimination by law of the primary diagnosis requirement. I certainly understand that that is one of the things that leads to the siloing effect. So there isn't much disagreement on what needs to be done. I think the question is, how do you put this into the field? And again, from my point of view, and I have written legislation on it, I think OASIS should have the primary responsibility in this area if the people have co-occurring disorders. If it's one or the other, if it's just mental health, then obviously that's an OMH thing. But I wanted to ask a question, as I like to do to learn things. A lot of people use this word clinicians. To me, it's vague. I want to know what is meant by clinicians. Is that psychiatrists, psychologists, social workers, other people? The other thing is CASACs, is that a clinician? There was another point I also wanted to make, but it seems that I got obscured by my question on the clinicians. But I'm really, to me, clinicians is very, very vague, and I'm trying to find out what exactly are people referring to when they use that word. Oh, I know what it was. I did remember. I'm sorry. So Stephanie can read my commentary in the Times Union on January 24th, 2022. You can Google it, concerning this issue of the co-occurring disorders, because in that article, I do try to address this issue of why not a merger. So I don't think we need to take time up with that here, but I am interested in knowing, what do people mean by clinicians?
So I'm gonna kind of first go to what you just said, because I guess I'm trying to conceptualize. You get rid of the primary diagnosis, and people are walking through both doors currently, right? They're walking through an OMH licensed center. They're going through an OASIS. Is the OMH crew now sending the people to the OASIS license?
See, this is the whole point. In my humble opinion, you're looking at this from the standpoint of what has always been done. And so what I'm trying to do is not have two systems, have one system, but the only question is who's in charge. It's that simple. So it doesn't have to be, OMH has regulations. It doesn't have to be that the license has to be issued by OMH. as long as the OMH regulations are followed. And what if OMH regulations are an obstacle to progress? Someone has to have the ultimate authority to write regulations that get past that point. So I
And in
think
an
the
in an
issue,
integrated single agency, there would be one.
that's your
consistent set of
argument, and
licenses and policies and
I
procedures.
understand. We have listened to you at numerous hearings. Unfortunately, sometimes human beings don't come to the same conclusion. But
And
on
I'd
the
like to jump
points
in
that
now
you raised,
before we run out of time to finish the panel. Thank you so much, Stephanie and Assemblyman Steck.
I'm
if
sure
you-
I'll
we
see you
find out what
again.
they mean by clinicians, though. That's very important.
Psychologist, psychiatrist.
It also depends on
marriage
who's using the
counselor,
term
everybody's
clinician.
licensed, yes.
What's that?
It also matters who's using the term clinician. What
Well,
does
we
it
gotta
mean?
have- What we try to do is we try to define people as being those authorized under the education law to diagnose and treat mental illness. To me, that's what I mean by a clinician, but others may mean different things. I don't consider a CASAC to be a clinician.
But they are a QHP and can diagnose substance use disorder. So I would like to.
Not under the.
They're a
education, I
qualified
don't think
healthcare
so.
provider. So I'd like to move on before we run out of time for Alex to ask his last question of the panel. Thank you everyone for your patience and for all of your contributions so far.
Greetings, everyone. My name is Alex Carpenter. I'm a young person in recovery, and I'm the Western Regional Youth Partner with Youth Power. Senator Harcum, Assemblyman Steck, it's nice to see you again this year, and it's nice to meet you, Commissioner Cunningham. So I know there was a $400 million budget in the executive budget proposal for OASIS to fund addiction treatment and support. In my own recovery journey, I understand how important natural community engagement and recreation can be. Will the state use these funds to support a more diverse range of community and recreational programs that help people build up new habits and natural supports within their community?
So who would like to, Commissioner? I see you've unmuted.
Sure. Yes, so you know, as you can imagine, the executive budget is right now proposed to be used to support a full range of services, right, that cover addiction prevention, recovery services, as well as harm reduction services across New York State. So, you know, in terms of the kinds of programs that I think that you're speaking to, really, you know, when I think about that is sort of the youth clubhouses, and then the recovery outreach centers that, you know, help provide with skill building, you know, recreational activities that, you know, improve health, you know, provide education and a lot more services as well. And so those are certainly, you know, part of what we're using the budget to support. But I think that this is, you know, it's not final. The budget is, as you heard, that there's still negotiation now, right? And so, you know, it's really right now a wide range, which includes supporting the services that you've brought up.
Thank you.
Commissioner, if I could just add for a quick minute.
Yeah. Yes, please.
Alex, to your point about recreational activities and natural supports in the community, we're updating the clubhouse manual to talk about some of those activities because many of them do offer, you know, things that are outdoors and different activities like that. And so we want to continue to get them to think about those natural supports and those wide variety of health and wellness activities that you may be referencing. So we've heard from the clubhouses and we've heard from young people, and we're updating that manual to be reflective of some of that.
That's great to hear.
Thank you so much.
Alex, thank you so much for your question. Sorry, I was muted there. And I thank Dr. Cunningham for her response. One of the other things that we're doing to look at this is when we created the lockbox fund for the opioid settlements, there's going to be an oversight board of folks from all over the state, from all different disciplines, to be making recommendations on how we can best use some of that money. So where have we shortchanged? Where can we make further investments that are working? And how can we look at, as you say, some of those holistic supports, peer-to-peer, physical wellness, those kinds of things. And one of the other things is also then how do we get folks, particularly in rural areas, to activities? Transportation in recovery is a big gap that we have. Last year in the budget, we passed funding for 2 pilot programs. One would be an urban one would be a rural one. So right now, you can get paid to go to a treatment appointment, but not much else. And we know recovery is about a lot of things. It's about jobs, it's about childcare, it's about recreational opportunities. It's about all of those supports that help people along the way to a successful recovery, whatever that means to them. So, we also need to look at some of these other supports, particularly in our rural areas, on how we connect folks, because recovery is all about connectedness.
Absolutely. I live an extremely rural part of New York. I completely understand what you're saying.
Thank you, Senator. Thank you, Alex. Any other comments? All right, we are at 3:20. We've gone past our time a bit, so I want to just thank everybody for participating in this incredible panel. Thank you for spending all of your time and being willing to talk about some hard topics. And if we're going to create some systems change and save lives and help end this overdose crisis that we're in, then we really need to find ways to come together in new ways. And panels like this are a great step in that direction. So thank you everyone who's participated. We will be sharing this on our website, so look for it. And we look forward to future opportunities to work together.
Great to see everyone. Thank you so much.
Thank you.
Thank you.
Thank you guys very much.
Take care.